Obsessive Compulsive Disorder, otherwise known as OCD, is a serious mental illness which is unwanted and extremely hard to control obsessive and compulsive urges. It affects children as young as the age of 7 years old, as well as teenagers and adults. 2 to 3% of children and adults have OCD during their life. Boys have a higher chance of developing OCD at a young age, although women throughout their lives tend to have OCD.
To meet the criteria for OCD, a person must be experiencing either obsessions or compulsions. If the person has only compulsions, they will do things without obsessive thoughts. And if the person has only obsessions, they will try to get rid of them mentally. Most commonly, people who have OCD have the obsessions with the compulsions.
OCD is also recurrent, persistent thoughts, impulses, or images that are experienced as intrusive, inappropriate, and that cause marked anxiety or distress. Their thoughts or impulses cannot be stopped, and they feel intrusive and don't like it.
According to Stanford Medicine, OCD started arising during the 1600s, although at the time they considered its symptoms of religious melancholy.
Other examples of OCD include people who suffer from OCD are germaphobes and cannot touch certain objects, such as the doorknob, without cleaning it first.
People with OCD also have a need to make sure everything is straight and perfectly aligned, and will fix it as many times as needed until it meets their standards. This includes any hanging objects like crooked picture frames and mirrors.
As mentioned before, they try to avoid anything that could possibly have germs.
People with OCD have a hard time making sure their hands are completely clean, which means they excessively wash their hands to a point where they may start to bleed. They also wash their hands in a specific order in order to make sure that they completely got all the germs out. They also fear contact with others in order to avoid contamination.
Those who suffer from OCD tend to organize and coordinate their wardrobes, which includes placing them in a specific order that they see fit, either by season, style, and/or color.
People who suffer from OCD often cannot light candles in fear that they might light their house on fire.
Those who suffer from OCD have a fear that they never completely close things, such as the straightener, and must constantly go back and check to make sure that everything is closed and in order.
Those who OCD affects tend to have an extreme need for cleanliness and for things to be spotless. They will continuously clean the glass until there are no marks left.
They are very organized and must make sure that everything is in order and aligned.
They always make sure that everything is perfectly aligned without any folds or wrinkles, which makes making the bed a very difficult task to do every day.
Those who suffer from OCD have a tendency to go over spots that are already clean because they have to be 100% sure that the surface is spotless and germ-free.
Someone who has OCD has a tendency to brush their teeth very often throughout the day. Sometimes they will even brush their teeth up to 20 times. They must also use a new toothbrush after each use.
They must make sure that they fold everything to their liking and make sure that they are symmetrical and according to size and color.
CBT is a therapy procedure where the patient and the therapist rate the patient's SUDS, which is where they list all the thoughts that make them the most anxious. And in therapy, they go through each and every one to make sure that when the patient gets an intrusive thought, that they do not neutralize it by engaging in their compulsion instead. Then needs to learn to sit with their thoughts and cope with it by doing more productive activities. For example, when they get a thought, they sit with it until it passes, so they no longer are distressed, and they partake in a fun activity to calm them down, like yoga or going to the movies with a friend.
Overall, it is basically just therapy sessions with a therapist to make the patient cope with their intrusive thoughts and ensuring that they do not neutralize it by engaging in a compulsion. Instead, they have to just sit with their thought until it goes away, and eventually the thought becomes less and less obsessive. By no longer making it important to you, you are no longer performing the act that is a compulsive behavior. There are many other ways to cope with OCD, some of which include seeking professional help from Doctors Giuseppe Alfonsi and Jonathan Petrogilia, who both have private practices here in Montreal.
Dr. Giuseppe Alfonsi specializes in CBT treatment and helps with problems such as anxiety, depression, OCD, and ADHD.
Dr. Jonathan Petrogilia helps individuals, families, and couples cope with OCD.
You can contact them at
One of the tips to help with your OCD is to try to understand where it stems from. Sometimes the cognitive approach may not be as effective because there is an unresolved trauma causing the OCD. In order to help with your OCD, the patient may want to understand where the OCD derived from.
Some celebrities that suffer from OCD are Howie Mandel. He refuses to shake people's hands because he has a fear of getting exposed to dirt and germs. Fun fact, he even shaved his head to make sure he doesn't have lice and to feel more clean. Another celebrity is Cameron Diaz. She suffers from OCD and continuously cleans doorknobs before touching them. It even reached a point where the paint would start to come off the door for how many times she cleans it. She also admitted in an interview that she washes her hands many times during the day at work and at home. Other celebrities who suffer from OCD are Leonardo DiCaprio, Jessica Alba, Charles Darwin, and Billy Bob Thornton, who have OCD tend to be very detail-oriented and would have noticed the cactus in every scene. Did you? OCD does not only have to be an acronym for Obsessive Compulsive Disorder.
It can also be an acronym for treating this anxiety disorder.
O. Overcome the obsessive thought. C. CBT treatment. And D. Don't give up. Overcome OCD with CBT and don't give up.
Overcome OCD.
Make it a thing of the past.
Seek help and act fast.
What doesn't kill you makes you stronger. Stand a little taller. Doesn't mean I'm lonely when I'm alone. What doesn't kill you makes you fighter. Puts that fever lighter. Doesn't mean I'm over, 'cause you're gone. What doesn't kill